Baltimore Gameday. Uncensored.
Sponsored by BrownsCar.com.
1057 The Fan.
Injury Report is brought to you by Orthopedic Associates of Central Maryland. In pain? Contact the experts at Orthopedic Associates of Central Maryland at mdbonedocs.com. Care this good feels good to the bone.
Injury Report.
Dr. Ralph Zade and Dr. Zade, good evening. What's that? No, we don't have it yet. We're efforting to get Dr. Zade as we sit here doing the injury reports. And it is Baltimore Gameday Uncensored pregame. Ken Wyman and Serrato. One of the interesting things is, and Dr. Zade joins us now. And Doc, good evening. Thanks so much for joining us. Nick Boyle was activated earlier this week, but now it looks like he's not going to play as they elevated Eric Tomlinson to the active roster. It's a knee situation. Could it be just stiff? What just your best guess? What could be going on there?
Well, I mean, earlier in this year, he had like what they call the cleanup. You know, a lot of times that can mean he has some scar tissue. Sometimes it can mean like maybe a meniscus injury, because he had a pretty bad injury last season. Probably just a little bit of stiffness. It's possible he had a residual meniscus or something like that, and sometimes those can be put off a little bit, as you try to push through the season, until the off season. So I would say probably something like that, where it's just taking a little bit of time to work out.
Now, Doc, it's 84 degrees, 82% humidity. What do you think the trainers and Harbs were telling them last night as they're getting on the plane and coming down here?
Well, that's something that they're at least used to here in Baltimore. So, I think that as long as they stay hydrated, which is obviously key in these kind of situations. I don't think it's anything that anyone isn't used to. I wish it maybe was a little warmer back here in Baltimore, but it's something that they definitely deal with, probably actually for a good chunk of their season, definitely in the preseason.
Dr. Zade, Brandon Williams' shoulder issue, it sounds like he's not going to play. Again, like your best guess, because of course they hide these things like government secrets. What do you think's going on with his shoulder?
Well, if it was something, really significant, like let's say a rotator cuff or a fracture or something like that, it wouldn't really be a day-to-day, a possible game type thing. So, I bet it's probably either a sprain of his rotator cuff. Sometimes you can have a small labral injury or biceps injury that, doesn't necessarily, even though it's torn, require surgical intervention, just kind of some rehab. So I think it's probably something along those lines, which are pretty common in higher level athletes, and often don't really end up requiring something too major.
Hey, Doc, when you saw, or maybe you didn't see the tweet that Matthew Judon said that it was the strength coach's fault why all these guys are getting hurt. Well, just to clarify, he said fire Steve. He didn't say it was their fault. Well, if he's saying to fire him, then I'm guessing that he said it's his fault. Just because they've had so many guys gone for the year, with ACLs and stuff, and, about getting guys back too early. Your opinion on a former player's comment that was in that building?
I mean, I guess that part of it is something, that maybe provides some insight that other people don't have. But, I don't think, I think in this kind of a higher level situation, that's always sort of the goal, is to, do what you can to try to, in a safe manner, get people back as soon as possible. And, when you compare the training regimens, when you compare the resources, the physical therapy that some of these guys have compared to, what would be the general population, they can be pushed a lot harder. I think, the decisions are made as to, is an injury, safe to go back to play or not? Does it require something more? Does it require a specific amount of time out or some additional treatment? If the case is no, then a lot of times it is as soon as they can be rehabbed to, more or less an assessment of being safe for the field, and these guys are in situations that most people aren't. So where the average person may take, 3 months, you can, to get back to something, and you push them to 2 months in this kind of setting. It's not necessarily wrong. It's just kind of the way it is.
Dr. Zade, as always, thank you so much for your time. Enjoy the football.
Thanks, Doc.
All right. Thank you, guys. Take care.
It's Baltimore Game Day Uncensored pregame show. Ken Wyman and Vinny Serrato. We're live here at the Green Turtle in Owings Mills. We are here until 8 o'clock. When we come back, we'll climb the depth chart. We'll go behind enemy lines, and we'll get our first look